How many vertebrae are present in a normal adult vertebral column? A. 26. B. 33. C. 24. D. 30. Answer: B. 33. Which vertebra is also known as the atlas? A. C2. B. C1. C. T1. D. L1. Answer: B. C1. Which of the following is a unique feature of thoracic vertebrae? A. Presence of transverse foramina. B. Bifid spinous processes. C. Articular facets for ribs. D. Absence of vertebral body. Answer: C. Articular facets for ribs. What is the function of the intervertebral discs? A. Facilitate the movement of blood through the vertebral column. B. Provide cushioning and absorb shock. C. Strengthen the spinal cord. D. Protect the vertebral arteries. Answer: B. Provide cushioning and absorb shock. What type of joint is formed between the bodies of adjacent vertebrae? A. Synovial joint. B. Fibrous joint. C. Cartilaginous joint. D. Pivot joint. Answer: C. Cartilaginous joint. Which ligament prevents hyperextension of the vertebral column? A. Anterior longitudinal ligament. B. Posterior longitudinal ligament. C. Ligamentum flavum. D. Supraspinous ligament. Answer: A. Anterior longitudinal ligament. The odontoid process is a characteristic feature of which vertebra? A. C1. B. C2. C. T1. D. L1. Answer: B. C2. Which region of the vertebral column has the largest vertebral bodies? A. Cervical. B. Thoracic. C. Lumbar. D. Sacral. Answer: C. Lumbar. Kyphosis primarily affects which region of the vertebral column? A. Cervical. B. Thoracic. C. Lumbar. D. Sacral. Answer: B. Thoracic. Which of the following is not part of a typical vertebra? A. Pedicle. B. Lamina. C. Clavicle. D. Spinous process. Answer: C. Clavicle. Which part of the vertebra forms the vertebral foramen? A. Body and spinous process. B. Pedicles and laminae. C. Transverse process and body. D. Lamina and spinous process. Answer: B. Pedicles and laminae. What is the normal curvature of the cervical spine in a healthy adult? A. Kyphosis. B. Lordosis. C. Scoliosis. D. Straight. Answer: B. Lordosis. Which structure passes through the transverse foramina of cervical vertebrae? A. Spinal cord. B. Vertebral artery. C. Aorta. D. Internal carotid artery. Answer: B. Vertebral artery. The Scotty dog appearance in radiography is associated with which part of the vertebra? A. Spinous process. B. Pars interarticularis. C. Vertebral body. D. Transverse process. Answer: B. Pars interarticularis. What is the main function of the sacrum? A. Protection of the spinal cord. B. Transmission of body weight to the pelvic girdle. C. Facilitating rotation of the head. D. Supporting the thoracic cavity. Answer: B. Transmission of body weight to the pelvic girdle. The intervertebral foramen allows passage of which structure? A. Spinal nerves. B. Spinal cord. C. Vertebral arteries. D. Dural sac. Answer: A. Spinal nerves. What type of movement is primarily permitted by the lumbar vertebrae? A. Rotation. B. Lateral flexion. C. Flexion and extension. D. Axial rotation. Answer: C. Flexion and extension. Scoliosis is characterized by A. Excessive inward curvature of the lumbar spine. B. Lateral deviation of the vertebral column. C. Exaggerated curvature of the thoracic spine. D. Flattening of the cervical spine. Answer: B. Lateral deviation of the vertebral column. The lumbar vertebrae can be distinguished from other vertebrae by A. Presence of transverse foramina. B. Small vertebral bodies. C. Large vertebral bodies and absence of costal facets. D. Bifid spinous processes. Answer: C. Large vertebral bodies and absence of costal facets. Which ligament connects the laminae of adjacent vertebrae? A. Anterior longitudinal ligament. B. Ligamentum flavum. C. Interspinous ligament. D. Supraspinous ligament. Answer: B. Ligamentum flavum.